session is in fact a continuation of what we just now heard, and that's about the challenges and opportunities while implementing the RCTs. And we have three very eminent speakers here who have done a lot of work on evaluation, and they are and we have the same three questions for them. So please make sure that in your presentations give a very short, quick overview of the specific impact evaluation that you undertook. Please discuss the opportunities of the impact evaluations that you experienced or you thought they are the opportunities, and also discuss the challenges. Okay, so given the fact that we have only 40 minutes, we give 8 minutes each. Is that okay? So that we can have some questions from the floor. So the first one to go is, I think, Kultar. Is that? Because I don't have, let me see. Let me correct myself if it is, no, Ramanan. So Mr. Ramanan, you got. All right. So why don't you just introduce yourself very briefly,
okay.
And as you know, what was done in the previous session, just talk a little very briefly about your organization if it is called for. And
sure.
Thank you, sir.
It's a real pleasure to be here, and embarrassingly, this is my first 3IE event, although we're right next door at the Public Health Foundation. So I shall make amends going forward, and it's nice to meet all the 3IE people. I had actually not planned on slides, and I saw other people presenting slides in just the previous session, so I made up slides, so maybe I shouldn't have done that. But maybe it's useful, because many of you might not know what PHFI is. We're essentially a public health organization. We have a charter which calls for education. We run 4 schools of public health around the country in Bhubaneswar and Hyderabad, Gandhinagar, and in Delhi. And we have 2 new ones opening up now in Bangalore and Shillong. We do a lot of research, in-service training, and then we run these large technical support projects, which essentially support government agencies like on immunization and HIV, for instance, and that gives us a context for doing research and capacity building as well. So I'll skip through all of this just to say that there's a lot that goes on here. We have centers of excellence that work primarily on research, but just to say we have about 500 technical staff, on projects, and about a fifth of those actually have PhDs, and we're a 6-year-old organization. We have roughly about 1,000 plus papers, which are primarily on health, and a whole bunch of partners, etc. A lot of our work, as you might expect, is not on epidemiology or determinants of health. It's really on health systems and policy, because everything that is relevant to India has to be relevant to the health system that we actually have. We cover a lot of areas: non-communicable disease, universal health coverage, tobacco control, immunization programs, polio, NRHM, etc., and that's just the publications and so forth. But I'm just going to give you 3 very quick examples. So we literally have, at this point, I would say, ongoing, we probably have about 40 or 45 impact evaluations. And if you sort of define that slightly more broadly, probably even more than that. I think you said to talk about 1, so I had put up 3, so maybe I'll just talk about 1. So, for instance, we're evaluating the Safe Birth Checklist that some of you may be familiar with. It's a checklist that WHO and folks like Atul Gawande came up with, and this is being rolled out at UP, but there's also a different project which is rolling this out in Rajasthan, and we're involved in that evaluation. We're involved in a very interesting RSBY evaluation, which we're doing with IFMR and colleagues at the University of Chicago and elsewhere, which is basically a randomized trial. We're randomizing 3,000 households to actually having RSBY, 3,000 to the equivalent cash transfer, and 3,000 to nothing. So this is essentially to see whether insurance programs actually provide value. Are you better off just doing unconditional cash transfers to people, or does the actual mechanism of the transfer via health insurance really make a difference? Let me talk about the third one very quickly, just because I think this is sort of interesting. This comes under a project called Saving Brains, which is funded by IDRC and many others. This is a Canadian thing. And what we're doing in this particular instance is we're looking at the effect of early childhood nutrition on schooling outcomes. And of course, this is hard to study with sort of our national data sets on things like ICDS, because all of the usual problems. There's endogeneity, program might have been rolled out better in places which also had better schools, etc. Now, what we're taking advantage of here, just to give you one example, is there was a Hyderabad nutrition trial between 1987 and 1990. 15 treatment villages, 15 controls. So they randomized us back then. So ICDS was rolled out in some villages ahead of the others, probably about 3 years ahead of the others. And so there was food supplementation, basically upma for the pregnant women, mothers, and children. And at that time, the effect was, the study objective was to assess the impact of on birth of infants. Now, one of our colleagues, very enterprising fellow, went back and re-enrolled all these people about 10 years ago for a study to look at the effect of childhood nutrition on cardiometabolic risk factors, probably 20 years later. So that's 2006, 2007. That was Sanjay Kindra's study. And now we're now going back to this. This is now funded by the Wellcome Trust to look at things like wage outcomes and schooling outcomes. So the second wave was in 2003, 2005. Managed to capture most of these folks. This was out. So just to tell you the area, this was outside Hyderabad. This was in basically Nizamabad, which was certainly rural Hyderabad, rural Andhra Pradesh at the time the original study was done, but now Hyderabad itself has expanded, so this has become sort of peri-urban. So the Kindra study, which basically looks at adolescents, shows that they were 14 millimeters taller, lower cardiovascular risk if they had early childhood nutrition. But now we're starting to look at, we're also starting to look at what the wage and other outcomes are. And I have results, but I didn't think I'd have time to present them, but I'm happy to share them with anyone who's interested. But we do see an effect on years of schooling. We don't find a result in terms of achievement, and that's obvious to many of you working in this area, because just going to school for longer is not a great idea if the school itself is really bad. And obviously the schools didn't get any better because of this evaluation, because of the randomization. So just very quickly, my last slide here is just to say, we face the same challenges as many of you do. Unfortunately, I wasn't here in the morning, so I'm sure these have been made again and again. We lack these national data sets. Routine data are not really shared. And these are challenges that we need to collectively solve at the national level. It affects literally dozens of studies for us, and over time, hundreds of them. Now, the smaller scale, of course, is again a disaster, because evaluation is an afterthought unless folks like 3IE pay for these, or they sort of embedded into other grants. There's certainly no baseline, let alone randomization. And of course, my problem is I have tons of these young PhDs are coming back. Literally in the next 3 years, I have 30 PhDs who are coming back into the country, having been trained in the UK under a capacity building program. They're all going to look for places to work to be able to do impact evaluations, at least some of them, not all of them. And there's the need both for the capacity building as well as for policy. And what we're trying to do is we're trying to create niches within what we do as technical support roles to be able to create those sorts of research projects. But also, we've done a systematic mapping of all research study sites that exist in the country. We really don't have that many demographic study sites. So if you go to the PHFI website, research-sites.phfi.org, we've essentially mapped the 25 largest study sites in this country, which have good baseline data that you can go back and do impact evaluations in. It has little videos which show you videos with the PI, what the study, what the underlying population looks like. So we've essentially mapped out a lot of this. It's all online and it's a public resource. Again, the website is research-sites, research-sites.phfi.org. And I think for those of you interested in contacting these study sites, this would be a helpful way to first see, do they do good work? Have they published? Are they able to do interventions? Are they able to randomize? All of that is in there. Now, just to give you a very last, just 1 minute, I said that was the last slide, but I lied clearly. So this is, in the context of a program that we run, where we actually support the National Immunization Program with about 30 staff who help run the program. Now, here's an example where we can create the context for impact evaluation of relatively small things that are operational, but then have scale consequences, because these will happen at the larger scale. If you take, for instance, vaccines in this country, nobody at any given moment has any idea where vaccines are, what temperature they're being stored at, and how many vaccines there are in the system, even though we have enough vaccines for 27 million children every year, and we have the 6 basic antigens, and we have literally about 27,000 cold chain points. Massive system, no idea where the vaccines are. So while I love, sort of paying people with plates and stuff to see if they'll come in for immunization, we've got a bigger challenge here, which is we have no idea where vaccines are and what temperature they're at. What we did as part of this technical support role, which is funded by Gavi and Gates, is we created this temperature logger, which is now in 105 locations and now going to be scaled up to the entire country. So we'll have data now from 27,000 cold chain points, reporting every half an hour into our central server here what the temperature is and soon what the volumes are. And what we found was basically a lot of these refrigerators, which are supposed to store vaccines, have huge spikes in temperature or they freeze. And freezing is deadly for vaccines. It kills the vaccine immediately, and spikes obviously are bad because that essentially ruins the cold chain. So we have this, and we basically have installed these all over the place, and they now send alerts out to the folks who are supposed to be dealing with this in the cold chain. The district immunization officer, the cold chain mechanic. I get an SMS twice a day summarizing what the status is of the system, in all the places we have it, and we'll soon have it countrywide. Now, here's a small example, which I find it neat. I mean, I'm trained as an economist, but these are things which I think are interesting because it just sort of speaks to the power of information to get response. So this is Rajpur Road here in Delhi. You have an SMS that's sent to the cold chain handler saying, look, your temperature is spiking over there. It's going out of range. And pretty soon, within about, literally about an hour and a half, they've managed to readjust the thermostats to bring the temperature back. We see that fairly routinely now that, these sort of informational feedback mechanisms can be quite useful. So, my own thinking on impact evaluation has changed quite a bit since, working more in the field here in India, much more than, what you do for publication and trying to get into econ journals. To me, this is the stuff that really seems to matter now. It has consequences at very large scale, but no one is really paying attention to these things, which are really the ones that are likely to, really make a difference in the chain. I'm not saying that this is the only thing that counts and other stuff does not, but I'm just sharing an experience that the kinds of things that I think of as being impact evaluation worthy has certainly changed a lot in the last couple of years, and I think that's my own learning here, which I'm happy to share. Thank you very much.
Thank you so much. Thank you very much for keeping to the time and for being very precise on the points that you wanted to make. So we'll go to the presentations, right? All the presentations. So Kultar, your turn, please.
Thank you. Thank you. In fact, I would like to tell briefly about organization Sambodhi. So we are primarily a monitoring and evaluation organization, and as mentioned, I think the evaluation and impact evaluation scene has changed specifically in India in last couple of years. And the first important thing is specifically to unpack impact evaluation. In last few years, impact evaluation has been used, overused, and abused word. I think everything is impact evaluation. Earlier we used to have evaluation, now we have impact evaluation. And in the garb of impact evaluations, we have sometimes an outcome evaluations, process evaluations. I've also seen in recent years an RFP for process documentation, if I would say, titled as an impact evaluation. So everything is impact evaluation, it's not evaluation no more. So that's the first thing. If I would say, we need to unpack what is impact evaluation. And for that, I think we need to have shared understanding of impact evaluation. The work 3I is doing is one step towards that. And also, we need to have capacities in design and executing impact evaluation, like building on the session earlier by Breakthrough and also by the panelists. I think they need to have a common understanding of the concept of impact evaluations, what we are going to measure, how far down the result chain we are going to measure, and do we have the capacities to execute, analyze, and use the impact evaluation findings for that, and we need to work towards that. And the challenge is specifically, there are some, I think, perceptions, and that's why it's important. The perception is impact evaluations are expensive. And not all impact evaluations are expensive. again, we are actually combining a lot of evaluation into one. Not all impact evaluation is expensive. Small pilot RCTs are not that expensive. If you are using DID, difference in difference methodology, it's not expensive. You are just building on the existing data. Then one of the challenges in impact evaluation is to actually ensure preconditions. And that is the most difficult part, like having a baseline. Now, impact evaluation and this trend specifically is the course of last few years. And if you see the projects in last 5 years, most of them projects don't have the baselines. Then the timeliness of results. If we have a large scale RCT, by the time the results are out, I think the project is either closed and there is no uptake of the results. Then we also have this tendency to use impact evaluation in isolation. That is the panacea for almost all our answers. We have the impact evaluation, so everything is covered. This is not the case. Impact evaluation needs to work with other methodologies, be it monitoring data, be it, if I would say, cost-effective analysis. So it needs to work with other methodologies. And there is a challenge in communicating the use and specifically the building the evidence decision policy continuum. I think we are not even able to bridge the first part, the evidence to decision. The evidence to decision to policy is a long way to go. And the key learnings, I'm going to summarize the key learnings overall, then I'm going to deep dive into specific methods of impact evaluations. I think the key learning is the right fit. I think we need to actually weigh on the different methods of impact evaluation, whether we are going to do RCTs or whether it's going to use any other method. The right fit is something which is very important from the perspective of the implementation organization. And it needs to build in as part of implementation design. We cannot come 2 year, 3 year down the line and say we want to do an impact evaluations. We need to have stakeholder on board. When we say stakeholder on the board, not only doing the baselines, but I think having a continuous dialogue with them, because in case of RCTs, we do see that design and implementation changes, and that completely throws away the RCTs. We need to be flexible and adaptive. If I would say, if one design doesn't work, do we have the fallback option? If regression discontinuity doesn't work, can we use the difference in difference? So we need to have that flexible and adaptive approach. And then optimum use of resources. We need not be, if I would say, overzealous in terms of having the optimum power. So we need to actually use resources maximally and can compute power, if I would say, accordingly. And if I would say employing mixed method as a storyline. And it's also important when we talk about timeliness to use technology. If you're using PDAs, mini laptops, then data can come, if I would say, 2 to 3 months earlier or 4 months earlier for analysis. We can use it almost real time. Then as I mentioned, impact evaluation should be in sync with other methods. It should use and build on, if I would say, on process data, also on cost effectiveness and monitoring data. It should not be an exercise in isolation. Now, these are the key learnings. I'm not going to go into the designs, but I think there are some of the methods, and each impact evaluation method has different learnings and challenges and problems. Now, I'm going to talk about one of the RCT which we did is a large-scale social franchising randomized control trial we are doing for BMG. The problem specifically is during the course of implementation, the design has changed. And because of the change in implementation design, and because government decided that we need to scale up not from 8 districts to the entire state, there is no control area. And beside that, there are a lot of times there are implementation targets. So we had 180 treatment area, 180 cluster as a control area. And it was specified that we are going to open, let us say, telemedicine center only in 180 treatment area. But they were not able to enroll enough telemedicine center in treatment area, and there were pressure on terms of implementation. Government is trying to scale it up. So they went into the control areas, and there was a contamination issues, and there were tussle between, if I would say, implementing organization and the evaluation organization. So large scale RCTs had this problem, if I would say, that if there is a change in design, if the government pressure is there to scale it up, and specifically the implementation pressure is to meet the targets, then these things could happen, if I would say, where we need to be very aware of the situations. Now, in terms of, I think using a method, if I would say regression discontinuity, is something which we used in a 3IE funded project in Gujarat while evaluating the Chiranjeevi Yojana. And we were actually focusing a lot on the BPL as a cutoff criteria, and we can use the bright line used in BPL as a kind of discontinuity and as a treatment and control group. But what we found, if I would say, the data for the BPL and APL is not worthy specifically, and there are a lot of errors and noise in that data. So we were not able to use that data because there are a lot of error of omission and commission in BPL and APL lines. So a lot of people in APL who have a BPL card. So that completely threw away our regression discontinuity design. But the design had this flexibility, and there was a differential rollout of Chiranjeevi Yojana. So we can use the difference in different approach, and we can use this some of the district where the program was implemented earlier, and some of the district where the program was implemented later, and used with the secondary data to come out with some aspect of attribution and impact. So I think these things specifically can happen when we look at the design. And now, in case of, I think, using difference in difference, the quality of baseline data, if we are actually coming at a later stage, the quality of baseline data may be there, but the quality of baseline data is an issue. Then matching of control and secondary data. We only have census data to match some of the control and the comparison area treatment areas. Now, those census data specifically on population and vulnerability may not be sufficient, and if I would say exclusively for a lot of other projects, be it on vulnerability, be it on violence. So we don't have that data specifically at district and sub-district level to match it with the treatment areas. Then the sample size and design issues. Now, most of the times because of the resource, there is always a weighing on. What sort of, if I would say, comparison area we should have? 50% or 30%, because there are some resources, and a lot of, I think, implementation organization ask these questions like, we are not going to intervene in comparison area, we are not going to there in control area, so why you require such a large sample? So there's always a tussle specifically in terms of resource and being optimal in the sample size, and the sample size we should have in comparison area. And also, if I would say, lack and timely availability of the secondary data, as rightly pointed out. We do have a lot of data, let us say AHS, DLHS coming on, but that data is usually not available for researchers. The fact sheets are available 2 years down the line, the data is available 6 years down the line. By the time the data is available, it's used only for publishing of paper. It's basically not, it's not used for any policy level influence. It's basically, if I would say, useless for any policy level 6 years down the line. And there are a lot of other concurrent data which we collect, but it's not made public. I think in India specifically, we don't have this habit of, if I would say, coming out with an open source culture of when it's come to the data and also sharing of the report. If that comes, I think a lot of these questions can really be answered. And in fact, on the last bit, I think when we're using different methods, like every method has a different challenges in terms of impact evaluation, propensity score matching. And if you're using matching, if I would say, it depends on a lot of other factors. It depends upon, if it's the kind of variable we are using to matching, the quality of existing data we are using for matching, and there exists a sample loss. So if we are using propensity score matching, it's very difficult to convince even implementation organization that we cannot do it for all indicators. We can only use it for key indicators, because by the time we go to the other indicators, the sample is not sufficient. We don't have enough power to actually compare. So that is something, these are smaller things, if I would say, which we need to have in our mind. And also specifically, the data sets. The lack of availability of the secondary data is something which actually, if I would say, kind of compromises whatever we are trying to do in terms of impact evaluation and trying to save some of the cost. And last slide, I think it's important to ensure the use of impact evaluation data and uptake of results. I think there's a lot of impact evaluations which we do, but we hardly come out with research and policy brief. Even if we come out with research and policy brief, it's not disseminated, advocated, and also followed up aggressively with the policymakers. It's basically, if I would say, it's just a kind of deliverables and we just do away with. Then the knowledge synthesis is a very important aspect. What is the necessary and sufficient condition for evidence to decisions? We don't ask this question, if I would say, prior to starting the evaluation. We usually come out with a research brief and documentation and dissemination plans once we have done the evaluation. This is something which we should have before starting the impact evaluations. And learning and dissemination, I think it's always important to have a close coordination with government and policymaker, and something which we have also observed while working on 3I projects. And specifically, if the government is on board, then you can do course corrections. Then you can go to the fallback option B, and you can still, if I would say, come out with a research and policy brief, we can actually answer their questions. Otherwise, what happens if there is a change in the design and implementation that we are not able to go with the original design, and we are not on board with the government and other stakeholders, then evaluation is useless. I think that they also lose trust in evaluations. And then it becomes if I was that someone came for the evaluation, they just went away and we didn't get anything. So it's important to have a constant dialogue specifically with government and policymakers. And I think in last few years, specifically with 3I, JPAL and other organizations, I think we have come a long way in terms of emphasizing the need for impact evaluation, but we need to build on the capacities, we need to actually ensure the use of the data, and we need to also emphasize on using alternate methodology in combination with the impact evaluation. So impact evaluation is not going to solve all problems in isolation. Okay, thank you.
Thank you very much. Good. Mr. Nagpal, can I request you to please make
Thank you, Mr. Verma, and I will not be using slides, and I'm glad I'm not using slides, because if I had any slides, my eminent colleagues who've already spoken would have covered everything that I had to say. So I'm going to speak a little extempore, and I'm essentially going to more or less echo what has already been said by Kultar and Dr. Ramanan. So a little bit about myself. I'm Somil Nagpal. I work with the World Bank South Asia region as a senior health specialist, and I've been working closely with 3IE in the recent past. We've had a reciprocal relationship. I did a program on impact evaluation and invited Joe. Joe is doing a program on impact evaluation and is inviting me. So I guess that about sums up the credentials why I'm here. That apart, it's also a pleasure to be sitting here with Ramanan and Kultar, both of whom are partners in some way or the other with my organization and with the work that I've personally been involved in. And also with several of you in the audience, Mushtaq, Dr. Tariq Ali, and others who've been colleagues at different points and in different geographies. So very briefly about what we are doing in this field of impact evaluation and where I'm personally involved. In the space of government-sponsored health insurance schemes, there are several activities that have recently been taken up in terms of trying to evaluate and understand the impact of these programs. And one where I am on the research team is in Karnataka, where we are evaluating the impact of a program that finances hospital care for about 40 million poor and informal sector beneficiaries in the state of Karnataka. And we've finished the baseline, and we had the advantage that the program had been rolled out in about half of the northern half of the state, and the southern half of the state had not yet rolled out. So we already have some interesting findings which we should be able to share in a few weeks. Some early findings have already been shared recently at the AIA program in Sydney. So we should have a manuscript shortly. Yet another one where our colleague Adam Wagstaff and some of us are providing some technical support to is an evaluation of the Rajiv Arogyasri program in the state of Andhra Pradesh that covers about 70 million people. As a bank, we're also working with RSBY in impact evaluation in the state of Punjab. And even in the impact evaluation of RSBY in Karnataka that Ramanan mentioned, Anup Malani has been a close associate for the last couple of years. I have been a sounding board and idea co-generator role with him even before the current design was conceived. And it's a pleasure to be in a part of this very exciting period when in the health sector, a lot of emphasis around evaluating the impact of these programs has come in. I don't know of any other period in our history where so many impact evaluations of health sector programs had been taken up at the same time, and there was so much active interest and so much of policy interest in doing this. And I think partly the debate around what's the good way of investing public money in the health sector has generated this demand for impact evaluation. I'm glad that we are at a stage where we'll be able to systematically see the impact and work and advise those who make policy about the right ways to go ahead in view of the evidence that's now going to be available from these. So in addition, we as an organization have several other impact evaluations underway, including on nutrition and other aspects of the health sector. We recently did a forum of government-sponsored health insurance schemes in India. That's a forum where several of you were present, and the 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 sharing of what is being done today by these programs actually inspired many more such requests and many more such initiatives. And since then, we've had similar work, at least at early stages, in both Uttar Pradesh and Maldives, where 3IE and the bank have started working together with our clients. Coming back to the question around challenges, and I think much of this has already been mentioned in this session, but just to echo something which I think is already our common understanding of these challenges. The first thing that comes to mind is what Kultar mentioned as a shared understanding of impact evaluation, and what I would echo as understanding systematic impact evaluation in the policymakers. Trying to get the right meaning of impact evaluation across to them is very difficult, because almost every study that has been done has the word either evaluation or impact. So between Joe and myself, we heard terms such as social impact analysis and impact assessment, and I could have I could create a vocabulary of the terms that we've heard. And many of these are not the understanding which people in this room would have around impact evaluation. The understanding does need to be improved, and the importance of rigorous and systematic research that could really give results on the impact is something that we need to together work on. And there's something I see as the biggest challenge to getting this more popular in addition to, of course, the recent popularity of trying to do impact evaluations, at least in some circles. The second challenge which I personally perceive is the policy case to make investments in impact evaluation. It does not come as a surprise that most of the impact evaluations that would have been discussed all this day would be based on grant funding. Where is the policy case to start investing a few $1 million in projects which spend few $1 billion every year to understand whether they are really improving or doing what they are really ought to do? And why is that not still a priority that is inbuilt as part of the program design itself? Ramanan mentioned about the absence of a baseline, and really that is an issue. We are told 5 years after the program starts, okay, now can you design an impact evaluation of this program? And then we work and conjure all the tricks of the trade and try to come up with something. But both in terms of an interest ab initio, an interest at the point of creating the program and building a rigorous impact evaluation design within the program, and the second in terms of building the policy case as to why can't we invest some, at least token money, a small share of the whole program in the impact evaluation. Can we think of many cases between this entire enlightened group of cases where the program implementing agency invested its own money in impact evaluation? And why is that not the case? Yes, they would support us with their administrative machinery and would provide in-kind contribution, but bulk of the funding is still grant funding. And that is, I think, a very important ownership issue that we all need to work together for. If there is ownership in terms of putting hard money behind impact evaluations, even if it's a small share and the rest of it is grant funding, it really shows that there is interest in learning, and it's not a researcher with a publication interest chasing a government to give him permission to do an impact evaluation. This is really something which I think we need to see, that there's a policy case that everybody understands the need to make investments. The third is about the policy application. Now, for example, if the impact evaluation shows that the program is not performing, what will happen to the dissemination of those findings? Will there be an honest dissemination of the findings, or will it be seen as a potential Auditor General paragraph as to that why this was done when it did not yield impact? The ideal way would be to stop putting money which does not yield the desired impact and to change it or modify it so that now you can try doing it in ways which yield better impact. But how would those findings be received, and how would that be applied to changing policy remains a question mark. And I think that's a big challenge, and sometimes that challenge applies ab initio even when you're thinking of an impact evaluation, because if I'm not sure that my program is yielding the desired impact, I would not want to do an impact evaluation. Yet another issue which all of those who have been working in this field realize is around the quality of field work and the available research talent in the country. In terms of how do you ensure that the training quality of the field agencies, or really the army that we depend on, how we ensure that the training quality was good? How do we ensure that the results that we are trusting so much are based on reliable data collection and data input? And how do we ensure that we have enough use of technology? Kultar mentioned about the PDAs. So how do you ensure that new technology, including GPS devices or photographs or video evidence, are available to us to improve our validation and timeliness of this data? And I think the final thing that I would say would be something which has been an area where I have personally realized many things, having been on both the sides, having been on the side of policy a few years earlier and now being on the side of a development agency with interest in impact evaluation, is about balancing the relevance of the subject of the impact evaluation for the needs of the policymakers and the publication worthiness of that impact evaluation. Sometimes what's relevant to the policymaker may not be that appealing in terms of getting it in the topmost journals. And I think that balance between doing what is right and most useful for the policymaker vis-a-vis what will get me a much better publication are things that we need to all introspect on and see that we balance that well, so that we really are able to do impact evaluations that contribute to policy and generate better evidence for policy making. With that, thank you very much for patient hearing. Thank you.
Thank you, Mr. Nagpal. So we are really almost close to our time. So may I open the session for questions, please? So are there questions? Okay. 1, 2. Are there more people with the hands? Okay, so why don't we begin there? 3.
My question is a general question, maybe to all three of you, all three of the presenters. I didn't attend the morning session, so I don't know what happened pre-lunch. But you all focus on the importance of impact evaluation. I think it is obvious, but I would like to hear from you the role of monitoring, for timely mid-course correction. Often we are talking about after 5 years, this is not working or so much invest. So I would like you to have your thoughts on the role of timely monitoring and timely mid-course correction.
Can we have the response of this question? Who would prefer to? Okay, Dr. Ramanan.
So I see measurement as different from evaluation. So evaluation would be where you want to see the overall impact of a project. You want to see, in the case of RSBY, which we're all talking about, if RSBY were actually rolled out the way it was supposed to be rolled out, does it actually have an impact, and does it make people's lives better? The question of how the RSBY is being rolled out in a particular district, and how you get the midterm data to make sure that the rollout is happening as you want it to happen, I don't see that as impact evaluation as much as measurement, and there are process outcomes that you look for, but not impact outcomes per se. So that just helps us separate measurement and those indicators from impact evaluation, but that's just one point of view.
Can the two be actually separate?
Well, they're answering separate questions. In one situation, you might want to know, are you doing a good job rolling out RSBY? That is not the same question as saying, if you rolled out RSBY the way it is supposed to, does it make any difference at all? Now, the latter question is very important, because if you didn't answer that question, it doesn't matter how well you roll out RSBY. So I do see these as separate questions. They might have linked frameworks for evaluation, but these are separate questions.
Can I just supplement? So I think there's no denying the fact that monitoring is extremely important from the implementation perspective of any program, and well-monitored programs would generally get implemented well. But the second part, whether the program does achieve its intended objectives as designed, or whether the design itself needs to change, it won't be an answer that will come from monitoring. It will be an answer that comes from impact evaluation. So you could have an example where the program is implemented in an exemplary manner and the monitoring shows that everything is perfect, but there's no real impact because the design had some flaw, and you could then go back with that impact finding, because when we designed it, we thought that something, when you do A, then B results. But when you really implement the program and do A very well, it may not result in B. And that's where you may need to go back, revisit the original structure of the plan, and come back with a revised, modified program that sort of now tries to achieve B better. No denying the fact that monitoring is important, but impact evaluation is studying something else and is essentially an important tool, not for day-to-day understanding of how well the implementation is progressing, but in understanding whether the original design itself is meeting the intended objectives.
Okay, we'll take other questions, but I think the point that the gentleman was making was what is the way of doing mid-course correction? Is there some way of doing so? We can come back, or you want to respond to this also?
I think I just want to add that nowadays I think we have this monitoring, evaluation and learning framework. So we don't talk about, if I would say this in isolation. The monitoring is feeding into evaluations, impact evaluations, and then we're also having learning report. So it's right from the beginning we have this monitoring, evaluation and learning framework, and there are different questions at a different point of the time, so answered by different, I think, data sources, be it monitoring, be it evaluation. So I think it's a comprehensive approach of monitoring, evaluation and learning, which is going to give all answers, not impact evaluation in isolation.
That's a new thinking which is emerging. Okay, all right. So the second question can we have? Yes, madam.
For Dr. Laxminarayan. I was just thinking through the course of this conference, we've been talking about policy relevant impact evaluations. And my question is that should impact evaluations become completely demand driven, or is there still merit in doing impact evaluations for the sake of fulfilling knowledge gaps? And this is more with the view of the comment that you made about, publishing in econ journals versus doing research that's relevant to the policymakers. So I'm working at 3IE right now, and that's the question that's occurring in my mind, is that should we only do research that is demanded from the policy people, or is there also merit in doing research that's just for the sake of getting out knowledge which is rigorous and things like that? Thank you.
So I'll keep it very brief. I think the two examples I provided were actually at two ends of the spectrum. The RSPY is, we're not interested in evaluating RSPY in a place where it doesn't work at all, right? So we're not going to go try to doing it in a poorly performing place. But the answer there is important. It may not be, the demand may not come from RSPY itself to know if their program actually works better than just giving people 450 rupees. So that's never going to be demand driven, and I think there is always going to be room for things that we call more researchy, things that, that we generate for knowledge's own sake. But there's also this room for this other kind of work which will never get published in an econ journal, but which the opportunities exist. In fact, the data also exist if we would only engage with the programs. And there, I think engaging with people who actually do work on the ground throws up these very interesting questions. And those, I think, are much more sort of demand-driven. So I think that's what you're hinting at, which is both are important, and I certainly would agree with you.
Yeah, hello, I'm Marcus. First of all, thanks a lot for the presentations. And I also work at 3IE as Shagun, and I have a question to Mr. Nagpal. You mentioned that you would like to see more funding for 3IE, for impact evaluations coming from the implementing agencies, right? And being built into their budget or coming from their budget. Now, somehow I agree that there is a need for more funding. We also see this when we look at the request for 3IE funding. But on another hand, I'm wondering, what about the independence of the evaluation if the funding is not coming from like third-party bodies?
So I think it's linked to the answer which Dr. Ramanan gave for the previous question, that there is a space for independent evaluations where the demand may not come from the policymakers. And in this case, it is important both from a perspective of creation of new knowledge as well as providing an independent perspective that such funding ought to be available. I'm not even denying the fact that there should be grant funding available even where the policymakers have an interest in it but may not have the entire resources required or part of the resources required, and there is some role for funding. My perspective was to show greater ownership by biting some component of the cost, which would also show that they have their skin in the game, which would show that they are interested in this and are willing to put their own money in it, but just that they still need more money than what they can put in today, or basically sometimes it could just be the better knowledge and better technical assistance that comes with the grant money that is providing a better rigor and maybe better quality of impact evaluation that would still be important. So I would actually want that there's more funding available for impact evaluations both from the policymakers and from the development partners. That would be ideal. But there should be some skin in the game. There should be greater ownership. I think that was the point if I didn't make it quite clear. Thank you.
I think it was a long day. So, you have something? All right. So, thank you very much. I think I would not dare summarizing some very, very pertinent points made here, except for underscoring the fact that Dr. Ramanan said, and that is, where is the policy case for investing into? For me, that's a very important point. I think all of us who are in this sector, if by doing all this rigorous work, if we can't convince policymakers up there to start thinking into the investing into impact evaluation of the national programs and policies, I think we are falling short of the expectations. So I think that's a lesson that I draw from this, apart from many other good points that all of you have made. Very exciting session. Thank you very much for your patience. I don't know what the next is lined up, but I thank